Smart.
Thank you, Pastor Nugent, and good night, everyone. My name is Karen Smart, and I would just like to thank your pastor, Pastor Solijan, Pastor Nugent, and your Health Ministries Director, Brother Knut Anderson. Thank you so much for inviting us here tonight to speak to you on this very important subject. We have a very informative presentation for you tonight. My sister and I are here because we're passionate about the subject. We will start by just telling you a little bit more about ourselves. So I will start, I'll give you a little snippet on my background. Then I'll ask Dr. Smart Clark to do the same. Then we will get right into the presentation. The presentation will take around 30 minutes or so, and then we have some time set aside for you to ask any questions you have. As questions come up, we will ask you to take note of them, jot them down, and at the end, please allow us to address as many of these questions as we can. So I have a background in psychology. I have about 25 years of experience in the health field, but in particular in mental health. I spent about 10 years working for the State of Connecticut Department of Mental Health and Addiction Services, where I provided direct care to patients who were acutely ill. The last 15 years or so I have spent in clinical trials. We conduct trials on medications seeking FDA approval. So I am currently serving as quality and compliance specialist for a leading pharmaceutical company. In addition to that, I have done some teaching. I am a professor of abnormal psychology at a small Christian college in southern Connecticut. I've also done some empirical research, mainly in educational psychology. So I have done research on the cultural factors that affect minority performance on standardized intelligence tests. I've also done research on the experience of success among African-American male college students. I've recently gone and got certified in mental health first aid because this is something that I'm passionate about. I'm passionate about people taking care of their mental health. And that's the reason we're here tonight. At this point, I will turn it over to Dr. Smart Clark.
Thank you so much. I echo the gratitude that Karen has shown to your pastors and your health ministries director. And my background is in internal medicine. I did start out in nursing. I, in the beginning, worked on my bachelor's degree in biology. From there, I did research, about 10 years of research in mostly ethnopharmacology, where we tried to determine how medications and how enzymes in different ethnic populations act on different substances that are put into the body, including many medications. From there, I went on to do a nursing degree, Bachelor of Science in Nursing at Florida International University. Worked about 11 years in oncology nursing, med-surg nursing, home care nursing, both inside and out of the office, quality management, etc. And I always knew I had a passion for medicine, so after that I went to Ross University to pursue a career in medicine. Since completing medical school, I did my training at St. Raphael's, now Yale University, for residency, and I'm now working as an internal medicine physician in the Bloomfield area. That's as outpatient treating physician and also as a hospitalist, where I encounter a lot of psychiatric cases in the geriatric population. That's the over 65 population. So I have been very, very passionate about mental wellness. And I've always known that Karen and I would collaborate on doing presentations like these, just to make persons more aware of how we can best help those around us who might be suffering from mental health issues.
Okay, so let's get right into the slides. I'm hoping I will be able to see. Okay, so we're talking tonight about ending the stigma around mental health issues. Ending the stigma around mental health issues. Let us start by defining a few terms. What is stigma? I'm going to ask you to talk back to me a little bit. What is stigma? Anyone? You can just shout it out.
Stereotype, judgmental, I'm hearing.
Okay. Anything else? I hear stereotype, judgmental. I'm sorry?
You're getting shunned by persons.
Shunned. Okay, okay. Okay, anyone else? What is stigma? A negative perception of someone or something. Yes, stigma is a mark of dishonor or disgrace associated with a particular person or quality or circumstance. Some of the terms we use that are associated with stigma include what? Shame, disgrace, humiliation, people being shunned, embarrassment, guilt. Why is it that we have so many negative things associated or negative terms associated with mental illness? Can someone tell me why? Lack of knowledge. Okay. If you went to the doctor and you did a blood test and you got diagnosed with high cholesterol, would you feel shame or embarrassment? How about if you had high blood pressure? Would you feel dishonor, guilt? Okay, maybe not. But we feel dishonor and disgrace and humiliation when it comes to mental health issues. Now, let us look closely at why that is. What are some of the terms, the colloquial terms we hear out there associated with people who have mental illness? What are some of the words used to describe a person with mental illness? Crazy. I hear crazy. Anything else? I'm sorry? Nuts. What else? Lose a screw.
Wound
Anything
too tight.
else?
He's wound too tight.
Wound too tight. Unpredictable. Which one?
Lonely.
Lonely. Okay. What else? Mad, crazy. All right. So those are some of the terms we hear. And so no wonder people are not coming forward and saying, I have mental illness. Those are some of the terms. You just said them. I came up with these by talking to some other people in a different congregation, but pretty much they're the same. Nut job, wacko, nuts, retard, mental. Okay? And this is the reason why many people are suffering in silence. Many people don't want to come forward and seek help because there is a stigma, a negative connotation associated with mental illness. So what do we do then? We have to stand up to stigma by having open conversations about mental illness, finding different words to describe mental illness, talking about it in different ways, and being transparent. Not being afraid to say, I need help, or a family member or a friend of mine might need help, okay? So that's why we're here tonight. Now, what are mental health problems? Let's define that one. A mental disorder is a diagnosable illness. Note that it says illness. It's a diagnosable illness. It affects a person's thinking, emotional state, and behavior. It also disrupts the person's ability to work or function normally. Okay, to carry out their daily activities. Let's face it, our moods shift from time to time, depending on the circumstance. It might shift from one moment to the next, but many of us will never have a diagnosis of a mood disorder because it may not be severe enough, or it may not last long enough, or it may not disrupt our functioning. But when the symptoms start to disrupt your functioning, then it is time to reach out and seek help. And so these mental health problems might include depression, anxiety, bipolar disorder, schizophrenia, very less common but very debilitating, okay? Even phobias, anorexia and bulimia, they're all mental health disorders. Okay, so let's look a little closer at mental health. Do you have mental health? How about you? A person might say, I don't have mental health. We all have mental health. But the real question is, what kind of mental health do you have? Is it good health or is it poor health? If you have a diagnosis of, say, high cholesterol, you might say, I'm in poor health. But if you don't have any physical diagnosis, you're going to say, I'm in good health. And so we all have mental health. Whether it's poor or good is another question altogether. So there is no health without mental health. The mind governs every action performed by the body. The Lord made us that way so that our mind, body, mood, and behavior work together to create the entire being. Now, I went too far. I wanted to bring your attention to Psalms 139, verse 14. It says, I praise thee, for I am fearfully and wonderfully made, and that my soul knoweth right well. God made us that way so that the mind and body function in harmony to create the entire being. Okay, so our objectives tonight, we want you to understand more acceptable terms to use around mental illness. We want to talk a little bit about the prevalence of mental illness in the United States, the most common mental health diagnoses. We want to just teach you a little bit about the signs and symptoms of mental illness so that if you have a friend or a loved one, or if you yourself find yourself experiencing certain symptoms, you will recognize it and know that it's time to seek help. We want to let you know the factors that contribute to mental illness and how to interact with those who may be suffering, what to say. Many of us don't know what to say. If a person says, I feel like hurting myself, what do you say? It's hard to decide. It's hard to determine. Many of us don't want to use the term suicide, even when we see someone on the verge of committing suicide. And so the person suffers in silence. They never reveal until the act. And then we say, I didn't see it coming. And so I would really like us to use some different terms. And at the end, we will give you some helpful community resources that I think we should have some copies here. I don't think we got all the copies, but I will have those ready for you and make sure your pastor gets some copies for you. All right, so mental illness is nothing to be ashamed of, according to Bill Clinton. So he said, the stigma and bias shame us all. How true is that? How true is that? So some of the professional terms used for mental illness are on the screen. Psychopathology, maladjustment, emotional disturbance, mental illness, psychological abnormality. But instead, we use the colloquial terms that make people feel isolated and create stigma, us against them. People feel like they cannot speak about their condition because they might lose social status. They might be discriminated against, it may be socially or in the workplace or even by insurance companies. Okay, so it's a vicious cycle. It comes back around to stigma. All right, so how many of you would walk right through this door if you saw that sign? Normal people welcome. Normal people welcome. On my first night teaching abnormal psychology, I would put this sign up on my door. And you would not believe the number of students who would come to the door. They would peek in and say, am I in the right place? I would smile and I'd say, if you're normal, sure. And they would smile and tentatively walk through the door. The reality is, even the experts do not know what normal is. So what is normal? The experts do agree that normal is on a continuum. Okay? It goes from one end of the spectrum to another. And so most of us, or all of us, I would hope, falls within that continuum somewhere along the line. Okay, so what the experts do, by the way, 1 Peter 2 verse 9 says what? For you are a chosen generation, a royal priesthood, a holy nation, a peculiar people, that you should show forth the praises of him who has called you out of darkness into his marvelous light. So based on our understanding of the Bible, we are not called to be typical. We are called to be different from everyone else. So in that context, we might not be seen as normal by some. So what is normal? What the experts agree on is that normal, even though they don't understand what normal is or don't agree on what normal is, they do agree that most mental health disorders have 4 features or 4 characteristics. And those include deviance, distress, dysfunction, and danger. We usually see these 4 threading through most psychiatric diagnoses. Deviance is different. Different from what? Different from norms. Different from what is typical in a society, societal norms. You may have cultural norms, religious norms, social norms, legal norms. If you deviate from cultural norms or social norms, you might be seen as different, extreme, sometimes even bizarre or eccentric, okay? If you deviate from legal norms, you will be seen as criminal because you can be locked up for that, okay? So deviance is different. Distress is something that's so unpleasant. The symptoms are so unpleasant and upsetting, okay? There is a group in Michigan that jumps into ice cold water in the middle of winter in November. Would you consider them normal? Some of us may not, but to them, it's a rejuvenating experience. It's not causing them distress. So the experts might say, this is not abnormal. This is, rejuvenating for them. It's not causing distress. And so dysfunction, something so upsetting or distracting that the person becomes confused. It interferes with their functioning. I had a patient come in for one of the clinical trials I was conducting. This was many years ago. This is a very bright young lady, 23 years old. She was going to an Ivy League college up in the north, and she came into the office severely depressed. And she was so depressed to the point that she was not groomed, her hair was not combed, it was matted. There was matter in her eyes. She had not brushed her teeth in days, and she had not taken a shower in about a week. And this young lady was a bright person. When you hear her speak, you will understand the caliber person I'm talking about. But because of the distress and the dysfunction, she was just not able to take care of her activities of daily living. Okay, that's what depression can do to a person. And then there is danger, risk of harm to self and others due to careless or even hostile behavior. So it doesn't only speak to deliberate acts of self-harm, but also situations where a person could harm themselves unintentionally by being careless. Okay? All right, let's move on. Why is it important to know what normal is? Because each year, about 44 million Americans suffer from or experience a mental health condition. But how many seek help? Less than half. Less than half will seek help due to stigma. People are not very accepting of it when we tell them we are suffering emotionally, okay? And so that's something to be mindful of. Statistics. Approximately 26% of adults in the US will experience a diagnosable mental illness, right in line with that 44 million. 18.1% are anxiety disorders, about 6.8% are mood disorders. Substance use disorders is at 8.1%. That's in any given year. Okay, 2.8% bipolar disorders. Eating disorders is not so common. Schizophrenia is even less common, but very debilitating. Okay, so these are the numbers. Now, mood disorders affect 1 in 10 US adults in a year. Depression, the most common, 6.8%. As I said, about the median age is about 32, which means those who will have experienced a condition or depression will have done so by the time half of the people will have done so by the time they get to age 32. That's a median age. It often occurs with anxiety or substance use. That's what we call comorbidity. Okay? More common in females than males. Why is that? Why is it that depression is more common in females than males? Any thoughts, any ideas? We have hormonal changes, mood changes. Anything else? One of the theories is that females are more likely to report it than males. That's just one of the theories. But there could be a number of reasons for that. It often recurs. If you've had one episode of depression, of clinical depression in your life, you have a 50% risk of having another one. If you've had 2 episodes, you have a 95% risk of having a third. Okay? And so it's important that we're mindful of these symptoms. All right. Features of depression, we'll talk a little bit more about that. It involves 2 or more symptoms, including sadness and anhedonia, or lack of interest, lasting at least 2 weeks. It only takes 2 weeks to get a clinical diagnosis for depression. It has to interfere with your functioning, your activities of daily living, your ability to work, your ability to have meaningful social relationships. This young lady I mentioned, she had to quit school. She came home from school because she could not continue. Okay? Many people cannot get out of bed long enough to go to work. Okay? So we're talking about clinical depression here. At least one of these 2 symptoms must be present nearly every day for at least 2 weeks. okay? An unusually sad mood and a loss of interest. And then there are other symptoms that may be related to that, including lack of energy, feelings of guilt or worthlessness, tiredness, difficulty concentrating, lethargy, lack of energy, or even agitation, sleep difficulties, loss of appetite or increased appetite, one or the other. Okay, so these are some of the symptoms of depression. And sometimes people go into their doctor's office and complain about some of these symptoms, and they don't recognize it as depression until the primary care doctor diagnoses it. Now, what's this one all about? Depression is no respecter of persons. So there's no shame to admitting that you may have some symptoms. Owen Wilson, a famous actor, he grossed over $2 million in his career. Yet this young man actually suffered from depression. Actually was suicidal at some point in time. George Clooney, another actor, he experienced an accident on the set of one of his movies, Syriana, I believe it was, and had a severe back injury. And he became severely depressed. He didn't know he would get through that. So those were circumstantial. Wayne Brady, some of you know Wayne Brady. What are some of the shows he does? Whose line is it anyway? Let's make a deal. Yeah, okay. So Wayne Brady is a person who is a comedian. He makes people laugh. And Wayne Brady came out and admitted that sometimes he has a hard time getting out of bed because he is so severely depressed at times. Okay. And so it was not until Robin Williams completed suicide in 2014 that Wayne Brady came forward and said, I want to put it out there that I suffer from depression. I don't want to suffer in silence. I want people to know that I suffer, because he might have, some accountability there, So it's important to be able to talk about your feelings. You don't have to put your business out there to the whole world, but be sure that the people close to you, people who you can be accountable to, are aware if you are suffering from something like this. Now, you might say these people are famous, they're actors, they don't know God. So that's probably why they suffer from depression. Well, let's think again. Sometimes it hits close to home. I myself have suffered from a bout of depression in my lifetime. The circumstances were such that I was assaulted as a teenager. Brutal assault. I was kidnapped and raped for 12 hours. And I was 16 years old on the campus of a college, and, younger than the average college student or college freshman by about 2 years. So I was very naive. And it so happened I fell victim to one of those older men who came onto the campus to seek out the new blood, as they would call it at the time. And so at the time, I buried it. I was ashamed. I was humiliated. I didn't want anyone to know. And so I asked my mother not to put it out there. I asked her not to press charges because I didn't want the shame and disgrace and dishonor, all of those things, the guilt. And so I buried it, pretended it didn't happen, and I went on and I made straight A's and graduated summa cum laude, straight A's for 4 years. I was doing well, okay? 4 years went by, another 5, got married, went down the road, and it so happened 9 years went by and I had not spoken of that incident again. And then some other things came up in my life, other stressors, and that's when everything came bubbling over and overwhelmed me to the point that I spiraled into depression. Then the anxiety took hold, and then there was panic attacks. And so I'm telling you, depression is a real thing, and it affects Christians, it affects all of us. Nothing to be ashamed of. I want you to know it took a lot to get through that. It took calling on the name of Jesus. It took reaching out for help. I recognize the symptoms in myself. I had been diagnosing with people with mental illness for about 5 or so, maybe 7 years by that time. And I recognized the symptoms, but I could not help myself. I had to reach out for help. And so I'm not going to tell you much more about that story because it is outlined in my book. The book is not a sad story. It is a story of resilience. It's a story of courage. It's a story of overcoming power. It's a story that says you too can get through any kind of adversity, whatever the case may be. And so that's what that book is about. It includes not only my personal story, but also a research component which just validates the range of emotions that people experience when they have gone through that kind of trauma. And so with that said, I want you to know that there is no shame in admitting if you have a mental or emotional disturbance. I will turn it over to Dr. Smart-Clark, and she will get more into some of the statistics and then talk a little bit more about the symptoms. Thank you.
Very good. So let's talk a little bit about suicide. And I have become a little more passionate about this subject because it not only has affected strangers, but it really came very, very, very close to home for me. About 700,000 persons per year we lose to suicide. In 2016 alone, 45,000 Americans over the age of 10 we've lost to self-harm. It's the 10th leading cause of death in the United States. In the last few years, we've had about a 30% increase in suicide rate. A quarter of the victims were not diagnosed with a mental illness prior to committing suicide. Does it mean that they did not have a mental illness? No. For the most part, it means that most of them were suffering in silence until it came to a head. We lose a whole medical school of physicians every single year to suicide. And there are a good number of people out there who believe that mental illnesses are brought on by the person, him or herself. True or false? False. Oh, so false. 35% of persons believe that it's because the person committed some type of sin why they themselves have mental illnesses. So what are some of the factors that contribute to mental illness? Cognitive theories. If a person has a negative outlook on life, that person may be more likely to suffer from depression or some type of other mental illness or mental breakdown than a person who's usually bright and chirpy and has a positive outlook, so we say. Sometimes hormonal disturbances. And I'm going to talk a little bit about sometimes nutritional deficiencies as well. When we talk about hormonal disturbances, if we discover that we had a hormonal imbalance in our bodies that produced some evident physical ailment, would we not go and seek help, medical help for it? Most often, am I right? Yes. And I brought this one up because acetylcholine, it's the same hormone that's responsible for dementia. That's also a mental illness. That's responsible for this condition called myasthenia gravis, where persons actually suffer weakness in the body. And so when you feel that your legs can't move anymore, would you go and seek evaluation from a physician or some medical personnel? Certainly. But oftentimes, when we have hormonal imbalances that cause us some type of mental derangement, we still don't find it necessary to go and seek help or evaluation for that. Acetylcholine, when we talk about myasthenia gravis, it affects the eyes, so vision is impaired, it affects muscles, it affects how we are able to swallow or even chew. And so in that light, I'm pretty sure many of us would go ahead and seek help. With treatment of myasthenia gravis, where 75% of persons used to die from this illness, just treating it, the mortality rate has been decreased to only 4%, 4.5%. So it's worthwhile seeking treatment when we have hormonal imbalances. In the same way, when hormonal imbalances cause us to have mental conditions like depression or even bipolar depression or schizophrenia, they can be managed, and we should seek help for them. So this is a nerve cell, and what you're looking at, I don't have a pointer, but just to my left, I guess it would be your left as I turn my back, is the nerve ending or a synapse. And this is where nerves communicate or talk to each other. And in those synapses are hormones. We have our epinephrine, norepinephrine, dopamine. Those are our uppers. So those hormones are responsible for elevated moods. And okay, point taken. So what happens is when those synapses or nerve cells do not communicate properly, whether it's because of lack of the hormones, too much of a hormone, or inactivity or decreased activity of the hormones, this can result in mental health conditions. I've heard this a lot of times. Patients come into the office, and when they outline some of the things that's happening to them, and I will say, well, ma'am, by what you've told me, I think you may be suffering from depression. I hear this a lot. Well, doctor, I'm not claiming that. Believe it or not, claim it or not, the problem already exists. And so what we really need to do is just to admit it and seek help for it. And that's really the bottom line. We don't have to claim it. It's already there. And I'm saying that because I have a very, very, very good friend, and I have to speak of this person in the past. This was a person who exudes joy and happiness and exuberance. This was a prominent leader in our church, one of our congregations, former congregations. If you saw this person, you would just light up because this person was just bubbly. And due to circumstances, he fell on really hard times in life. And when he started to spiral into depression, some people may not have recognized it as depression. Others called it he was just selfish. And others, even as they recognized it as depression, didn't know how to address him, didn't know how to get him to seek help. And on a dreadful day, he committed suicide in the most gruesome fashion, beyond recognition. His family could not recognize him when they went to look at him. And so I want us to be able to recognize the symptoms in our loved ones and be able to go out, seek help for them, or if we see it in ourselves, seek help for them. We've talked about the hormones already, so I'll go on. Some medications that we take for other medical conditions can result in some depression sometimes, and I often hear that I don't want to take this medication because of side effects of it. But for the most part, when physicians or other healthcare persons are treating conditions, what they do is they weigh the benefits against the risks, and if the benefits outweigh the risk, then they find that it's more beneficial to treat, and they will go ahead and treat. So there are two types of depression. There's unipolar depression, in which a person is depressed most of the time. Flat, cannot get out of bed, they're not keeping up with their daily activities, they are not going out and having a good time with friends as they used to. That's the anhedonia part. Dr. Smart talked about a little bit earlier. And then there's bipolar depression, whereas if a person who has bipolar depression is treated with an antidepressant, that can be a very dreadful thing for that person, because then they go to the other end of the spectrum and they become manic, because bipolar is just like it says. One day a person is as flat as can be, cannot get out of bed, and then after a few days or a week or so, their mood is so elevated that they're now almost out of control. They are very erratic in behavior. They'll go out and spend all their money. They'll empty their bank accounts. They will have inappropriate sexual behaviors. They will just do things that are very, very unlike them. And what a person like that would need is something like a mood stabilizer, because you just want to keep them even, not treat them with an antidepressant. So genetics can play a role. If a person has depression, for example, and they have children, those children, offspring, they're more likely to suffer depression as well. Bipolarity is another one. Schizophrenia, 50% chance that the offsprings of schizophrenics will become schizophrenic as well. Now, depression, there are certain medical conditions that can mimic depression, like thyroid derangements. So if a person has hypothyroidism, they may behave just like a person who's depressed, because it really does cause depression. But in that person's case, if that person did not seek medical evaluation and get their hormone levels checked, the thyroid hormone, for which the treatment would be to replace the thyroid hormone, and that behavior might be normalized and you won't be depressed anymore, they would never know. So in that person's case, the treatment is not an antidepressant, it's just replacing thyroid hormones. Now, clinicians don't readily just throw drugs at everybody who comes in their office for depression or any other kind of psychological derangement. What they do, and each case is really decided on a case-by-case basis. If a person needs antidepressant, they may get it, but there are other therapies like behavioral therapy, cognitive behavioral therapy, counseling, that's going to be helpful, and that's all tailored to each individual. Who's at risk? Many persons are at risk for depression, but persons who've suffered losses in life. If you've lost a loved one, especially somebody who suffered the loss of a child, loss of a spouse, somebody that close to you, very, very, very high risk. The elderly patients who've become lonely, many who have lost spouses are now living alone and do not have a good support system from their family or church family, they're at risk. The freshman in college who has gone away from home for the very first time maybe and has not really formed a social network of friends as soon as they get to college, those persons can suffer from depression. Anybody who's had trauma that Karen spoke about a little bit earlier in life, and even persons who've suppressed it for years and years and years, they remain at risk for depression until they get some sort of treatment to really go through and deal with whatever that trauma was. Persons who've had chronic pain. I've had a lot of persons come into my office. Chronic pain from arthritis, pain from a variety of illnesses. And they refuse pain medicine oftentimes, and they're depressed because of the chronic pain. If you don't feel well, you wake up with pain every day, you cannot be in a good mental space. That's going to affect your outlook on life. It's going to affect how you're able to interact with your children, your family, etc. So the treatment for that person is the treatment of pain. Treat your pain, your depression will likely be lifted. What are the warning signs? Let's try to identify them in the persons around us. Children, sleep. Sleep is affected by persons who are depressed. They're withdrawn, energy is just low all the time. They just can't get going. They're helpless, they feel hopeless, they will say things. Look at the Facebook pages of some of our young people sometimes, and you'll know exactly what they're thinking. And not just young people, older ones as well. But they will utter some things on social media that they may not come to you as parents and say. So, you know, it's nice to have that very close relationship where they would come to you and say something, but if they don't, you ought to be able to know what's going on. They will start using alcohol or drugs, and it's sometimes just to mask what they're feeling. So we really need to identify it. If a little child says to you, you know, they're sick every day. I don't want to go to school. Mommy, my tummy hurts today. You know, they may be bullied at school, and this may be spiraling them into a depression. So it's very important that we keep the lines of communication open so that we can identify what's going on. They're crying all the time, and so there are anxieties, another thing that we can talk about, not just depression. Now, anxiety is on a spectrum as well, because anxiety can go to the other end of where a person is going into panic attacks. They feel that sense of doom. They feel like if they don't get help right now, they're literally going to die. They're sweating, they're crying, they're hyperventilating. If you don't help me right now, they end up in the emergency room all the time. And this is because they're anxious, they have an anxiety disorder, and it really needs to be taken care of. Risk factors, gender, we talked about women who are more at risk for some of these disorders than men, and who are more readily diagnosed, and that's because they're more likely to go and seek help than males. All right, schizophrenia. How many of you have heard somebody say, I just keep hearing the voices? The voices, the voices. Yes, we hear it all the time. The voices are telling me too. So they're having what we call command hallucinations. The voices, sometimes they think persons on the television that they're watching are telling them to do something, to commit an act. It could be an act against someone else, even a loved one, and it could be an act of harm, self-harm as well. They're confused. They can't function. They're indecisive. Schizophrenia affects 2.4 million Americans. So the hallucinations is not just auditory, meaning the voices, but they're seeing things in the room that other people are not able to see. Oh, can't you see the cats crawling on the wall? Or the bugs, they're on my skin and they're itching. They'll tell you sometimes. Listen out for them. I have to tell you, and the difference is when people are treated for these disorders, they can lead very normal, functional lives. I have two patients I'll tell you about. This one young lady, she comes to the office every single month. She is a professor, a college professor. She has earned her doctorate degree and highly functional in society. But she will tell me, she says, doctor, if I don't come and get my injection every month, you would not want to see me. You would not recognize me. And that person, she has schizophrenia, and she knows without her medication, she would be just as lost as ever. She would not be able to function and lead a normal life. Another young man I know who ended up committing suicide, and that was just one of the saddest things, because at this young man's funeral, the persons who were giving tribute to him, every single thing that they described about this young man from he was yay high up was echoing schizophrenia, schizophrenia, schizophrenia. But somebody pointed out earlier, lack of education regarding mental illnesses. Even at the funeral, as persons spoke, many of them did not recognize that what they were saying about him was everything about his diagnosis. This young man, he was very artistic. And that doesn't mean every artistic person has a mental illness. But what happens is many persons who suffer from especially bipolar disorders and schizophrenia, they're artistic people. And when they have this high for the bipolars, that is when they get their inspiration, and they will give you the best work of art ever. Not just art as in paintings, but the singers will write the best pieces of music, etc. This young man, he was around everybody. He saw things. They said this. He just saw the world differently, and he really did. But he was seeing things that other people were not seeing, and nobody recognized it as schizophrenia. And one day his father got the call that he was unconscious in the hospital from an overdose, and he was not able to be revived. Very sad. It touched home a little closer for me because somebody who was in my family really had an attempt at suicide as well. Thank God it was not completed. But I have to say, we have to be able to recognize the signs and try to do something about it. There was another young lady who was so highly functional. This was a medical personnel at one of the highest levels in medicine. And everybody saw her, and she came and went and laughed and talked. What many persons didn't know is that she was taking medications for schizophrenia. And one day, she came, she taught lessons in church, etc. She came to church, taught her lessons, smiled at everybody, talked to everybody. Lunchtime, went home. We never saw her again. And what we learned the following week was that she took her own life. Very sad. And it's happened one too many times. So if we can only recognize symptoms and help people get some help. Another type, so there are different types of schizophrenia. It's on a spectrum again. There's the paranoid schizophrenic who believes everybody's after them. Have you heard people say, they're coming after me, they're out to get me, I'm telling you. And you can't understand why they are speaking like that. And then there's the other person on the other end of the spectrum who is catatonic to the point where they do not say a word. This is a person who you've known to have speech, but they have come to the place where they have had paucity of speech and they no longer speak. Another type of schizophrenia. Okay. So, did you know that 75% of patients develop schizophrenia between the ages of 15 and 25 years old? Young men are more likely to become schizophrenic than young women. Approximately 10% of people who are schizophrenic will commit suicide. I want you to imagine how good it feels to function normally. Isn't it nice when you're able to interact in a positive way with your children, with your spouse, with those around you? The objective of treatment or therapy is really to have persons be functional, feel good again, and lead a normal life, whatever normal is. So, the goal of therapy is to change behavior, to decrease the voices, as in schizophrenia, to decrease the impulsivity, as in persons with bipolar depression who are on the manic side, and to level them out or to stabilize their mood. I had another patient who was both bipolar and schizophrenic. How many Jamaicans are here? Any Jamaicans in the audience? Very good. So you may understand, and I'll translate if anybody needs it. But I went to, this was in medical school. I was a student at a New York hospital doing a rotation, and I met this young man, and I saw him on the ward, and we connected because we're both Jamaicans, and he was busy on the phone a lot of the times and making arrangements because his discharge was upcoming within a few days. And he was a disc jockey, and he had a big stint coming up on the weekend. And he was making arrangements for it. The next day I went and I saw him again. He went to the nurse's station and he made a very, very simple request of the nurse. And she delayed granting him the request. And you wouldn't believe the reaction. He pounded on the glass, he kicked, and everybody had to take cover because he was so out of control. If he caught her or anybody else, he would just rip you to shreds. That went from this real escalated behavior. Everybody had to be called, Dr. Strong, to now come and contain him. And from that, there was complete silence. He had to get an intramuscular injection just to contain him. He slept. I didn't see him again for about 3 days. Then I saw him later, and I said, "What happened? What happened to you?" And he said in his strong Jamaican accent, "A long time I know there's something wrong with me, From me a little boy. Them used to say me rude and beat me." So he knew in his own head from he was a child that something was wrong with him. And he couldn't understand why he would get a whipping for being rude. He was a schizophrenic. He was also bipolar. And off of his medications, he was no use to society nor to himself. When he was on his meds, he was able to conduct his business and really, really be highly functional in society. So there is a place for medicine. What I really want us to know tonight, that it is time to heal. What we need to do is focus on getting treatment, whatever that might be. If it's just counseling, or if it does involve some medication and then medications are weaned off and then it's only counseling for a time, we want you to take advantage of it. But don't be shy about moving forward and getting help. I'm trying to. All right. Eat a healthy diet. Because often persons think that every mental illness can be cured by just eating a healthy diet. But no. There's a place and a time for everything. B12 deficiency can manifest itself as depression. So, but if you get your B12, as many vegetarians who don't eat meat or dairy products may be deficient, check your B12 level, have your doctor check and get it. Sometimes certain herbal preparations can help us with mood, like ginseng or St. John's wort, and we can take those. Melatonin can help us to get some sleep, but there may be a time where a person might need something more than that. The domino effect we've talked about, interaction with family, friends, able to hold down a job. Just think about it. If you're in good mental health, you do better at all of those things. If you're not, not so, correct? All right, so some of the limitations to treatment, we did talk about that lack of knowledge, insight, the stigma, the stigma, the stigma. Let us not fall victim to stigma and not seek help. Prayer, where do prayer and religion come in? We always have to seek God's face. But the same God, I always draw the analogy of, you know, we don't use telegrams anymore to get communication from here to Jamaica or Africa or any other part of the world, right? We get on the internet. We have Instagram and we have all these other media that we can use. So we don't use horse and buggy anymore either. We want to get somewhere very quickly. We use an airplane, right? Or some other means of transportation that really gets us there. Let's take advantage of what modern medicine has to offer, because it really is the same God who's given us the knowledge to advance in technology when it comes to many other things, that has also given us the knowledge to treat mental illnesses and be in good mental health as well. What I want us to do is, above all, prosper and be in good health, mental health, even as our souls prosper. These are some of the resources that we have used, and we have them available for you as well. If you're not able to see the screen, the wording may be a little bit small, but they're here and they'll be provided for you if you need them as well. And at this time, we have some websites there. I'm going to take your questions because I really don't want to take any more time. Be a better you. Get help, be a better you for you and for those around you. I will stop at this time and we'll take some questions. I want you to not be afraid. Just ask anything. I see a hand. Yes, the mic is coming.
Maybe it's an observation. And over the years, I've been wondering what our church on a whole has done. Because there are a lot of times families, they lose their loved ones, their children. And I find every time we said, okay, we'll pray for you. But we never we don't have the resources in church, like a mental health team to help, because they do need the help. Because I know of a particular lady, she lost her 2 kids, her husband, and when I mentioned to her that you may need some help because I see you're suffering from, depression, and you need how to cope because you're getting up 3 o'clock, you're angry and everything. And she's like, in plain Jamaican, me look like me mad to you. But it's not a matter of mad, I say, no, you're not really crazy, but how do you cope? And I think we as a church should look into because we people go through divorces, lose their job, they go to depression, and everybody smile and have that facade, and as a team we should be a little bit more observant. Mental health team should be a little bit more observant, as well as we, especially us. I can talk for Caribbean folks. We are not open to say, I'm going through depression right now. I'm going through a little bit of an issue right now, and I need some help. And I think more of this need to be done in our churches.
Thank you for your observation, and I've had the same observation, and I think a lot of it goes back to the stigma. We don't want people to think that we are abnormal or different. And so what we can do is really change our outlook on persons who have mental illness and look at it like diabetes or hypertension or high cholesterol and treat people as such. Yes, behavior is different, but if persons don't feel marginalized, then they will be more likely to come forward and seek help. I agree that we need more support groups in our churches that will foster mental wellness, because that's something that we're really lacking in. And if we have our health ministries leaders who can rally some of the troops of persons in our congregations, often we have social workers and nurses and physicians and other healthcare personnel who can be resources to help to form support groups, so persons in a smaller setting will feel more comfortable airing some of their distresses, instead of having to go into a larger forum. So thank you very much for that observation. Any other questions, observations? No? We've said it all. Wow. Well, thank you. I'm really hoping that this is helpful or has been helpful, and it's just beginning the conversation. And it won't end here, but those of you who are within earshot will, take the banner and move forward with it so that we can have a mentally healthier congregation and people as a whole. Thank you so much for your time.
We want to thank Dr. Cameale Smart Clark and Karen Smart as well for their very informative and very helpful presentation. Material that's helped us be able to understand a little better how we can be of a help to those who are in need, and also to truly begin to have the conversations that are necessary for all of us to have that abundant life that Christ has for each and every one of us. At this time, we're going to end our online stream with a word of prayer. So we invite you to bow your heads as we pray. Heavenly Father, we thank you again, dear Lord, that we have hope in you. There is healing, dear Lord, even if it is in medicine for a time, dear Lord, and or even for a longer period, dear Lord. We know that you have also helped man to come up with these medical interventions so that we might be able to live life to the fullest. So we ask, dear Lord, that you would help us, dear Lord, to be able to honor, to respect, to help people, dear Lord, to enter into restoration and healing. That you would, dear Lord, help us as a church, dear Lord, to find ways in which we can also, dear Lord, be a help to those who are in difficult times, whether it's through support groups or just having resources like the papers that have been handed out here. We thank you, dear Lord, also for those who have gone into these arenas, the areas of medical and mental health, that they can be able to bring their expertise and share it with us, dear Lord, that we might be able to know a little better how to navigate these troubled waters. Bless us now, dear Lord, as we dismiss from this time together. We pray in Jesus' name. Amen.